Having successfully applied for and secured a £100,000 health and life sciences research grant from Innovate UK to develop and validate a novel test method investigating exudate management dressings and devices, the Perfectus Biomed, Huddersfield University and BSN Medical stakeholder team got straight to work. The first task was to research the different facets of the test methodology. As the concept was to create a method as close to a real-life wound as possible, the team discussed with the clinical specialists involved what sort of wounds were most prevalent, what was the standard rate of exudate produced by a wound, where on the body do they occur most frequently, and what are the challenges presented in dealing with wounds of this type. Having identified leg ulcers as a growing burden to the NHS, it was then the turn of the scientists to discuss leg models, mounting the synthetic skin onto the models, how many fluid ports to include, and the locations of these ports, the constituents of the simulated fluid, and which dressings and devices to use to develop the model. This took several weeks of investigation and discussion to finalize the finer details and to then start the testing. For more information on this exciting project and the progress the team has made, email info@perfectusbiomed.com.